Hi everyone, this is Lucía Chávez, certified nutritionist and chief nutritionist at Obesity Control Center. So today I'm going to be answering the questions that you have had from the webinar. And let me get started. The first one is about how many times to eat. It says that it was stated in the webinar that we do not need to eat 5-6 meals a day. Is this true for sleep patients after they are healed? How will we ever consume the necessary protein if we eat 1 or 2 meals? Or was that just for the people who have not undergone weight loss surgery? That is a very good question, and thank you for asking that because it is a common question and an important one. And I like the way that it was phrased. Is about sleep patients after they are healed. And that matters because there are different stages through this journey. And early on, the restriction from inflammation in the sleep is so much that you need to eat very often to be able to meet your protein needs. And as you heal, as inflammation subsides, then you don't have that much restriction. So it should be easier to get your protein needs and the rest of your nutritional needs from mainly food. But say between 4 months out to 9 months, you probably will still need a protein shake just to make sure that you get enough, right? After 9 months, pretty much the sleeve has already the final size. And at that time, of course, you can eat a little bit more. So how often do you need to eat? It really depends on how much you can eat at one meal. So say, for example, if you can eat 10 grams of protein at one meal, then you will need to eat at least 6 times if you are a woman or 7 times if you're a man. So that means that you will be getting the minimum of 60 grams as a woman and 70 grams as a man. But if you can eat 15 grams of protein, then you would only need to eat 4 times in a day. Now, that is better compared to having protein shakes all the time, because then it would be pretty easy to say, all right, okay, so then I'll just have 1 or 2 shakes and I have 20 grams of protein there and I just eat once and that's it. Nope, the restriction of the sleeve is for solid foods. So as inflammation subsides, you should be able to wean off the protein shakes and eat from real whole foods. So the recommendation of trying to eat less often is still the same for everyone, because we shouldn't be having the spikes coming from eating so often. The glucose spikes, those are the ones that we're trying to minimize. So it really depends on how much you can eat at one time, and that is something that you need to determine yourself. So depending on your own protein need, then and how much you can eat at one meal, then that's how you determine how many meal times to have in one day. But of course, there's no snacking. Snacking is it's not for weight loss surgical patients, and it's not for patients who do not have the surgery, and it's not for people in general. Okay, so there's no snacking. Every meal that you have should be a complete meal, and you should be using the formula: protein, fiber, and fats. All right? Okay, and the second question is 3 years post-op. I still can eat about half a cup of food at any time, but what I eat is still critical. Half a cup of ice cream is as easy to eat as half a cup of salmon. Actually, it's easier to get half a cup of ice cream than salmon. So yeah, what you eat is critical all the time, every day. Whatever you put in your mouth matters, especially now, especially when at this moment we cannot spare, or we cannot get our nutritional resources. We just can't waste the nutritional resources we have, and we cannot distract our body dealing with inflammation that comes from foods, because we need our body to be ready to fight off this threat, this coronavirus threat. So what you eat is critical all the time. And as a sleep patient, then you'll notice that there are lighter foods, right? So when you eat ice cream, when you eat popcorn, when you eat potato chips, when you eat crackers, then you can eat much more out of those than from, say, red meat and a raw salad, right? So then we need to be aware of the combination of foods that we're eating and the type of foods that we're eating, because most of the times the lighter foods, the ones that slide right through the sleeve without helping us feel full, and without without promoting the satiety and not helping with the hunger. They probably help with the appetite at that moment, because appetite is emotional, but you're not providing nutrients, nothing like that. But anyhow, lighter foods are mainly processed foods from processed carbs and processed fats. So you're getting nothing from that. And the right combination of foods should be, then again, real foods, whole foods. Okay, you shouldn't be having protein bars or stuff like that. That's processed food. So real foods should be put into a perfect plate, and the perfect plate is by using the formula of protein, fiber, and fats. All right. So if you have that in your plate, then you are eating healthy. And the last question, do you do that insulin test mentioned during our pre-blood workout at OCC? No, we don't, because it doesn't have a surgical reason for it. We already know that our patients are insulin resistant. That's the obesity is the first sign of insulin resistance. Well, not the first, but it's an obvious sign. Okay, we can have other responses from insulin resistance, like hormonal problems, right? But it is an obvious symptom. So there's no reason. I mean, the surgeons or there's just no surgical reason to get the insulin tested. That should be tested by the PCP, and it should have been tested like 15 years ago. And that, because that's when things started going bad, and that's when it should be known that your body cannot tolerate your lifestyle. But it's not commonly measured. It's a very important biomarker for prevention, and it's an important biomarker to be able to see the progress of how metabolically fit you're becoming. So you might want to check that out after the surgery, and continuously after that, at least once a year. And ideally, it should be between 2 and 5, and that is fasting insulin. That's how you ask for that biomarker. So we always want to be nice and low, between 2 and 5. If you have it at 9, if you have it at 11, then it's important to know, because then you can measure it. Then you know if the changes you're making are actually impacting your metabolism, and then you'll know about your progress. There are a few markers that can be used for that purpose. Probably you are familiar with A1C, right? And that is commonly measured. Glucose is really, yeah, you can measure glucose, but it relates to what you ate yesterday, so that could change every single day. So that's why A1C is important. But there are other biomarkers like PCR, high sensitive PCR. That will also tell you if what you're doing is having an impact in your body, either benefiting, or either giving you a benefit or damaging something, right? So PCR should be below 2. Lab work usually would say up to 5, but you don't want PCR to be so high, because by then, then you can diagnose it as function, right? So the whole idea is not to diagnose disease. The idea is to know when things are going bad. So that's way before you get into the higher limit of the range. So PCR, high sensitive PCR should be below 2, and fasting insulin between 2 and 5, no more than that. So that's how you track the progress. I love these questions. So whenever you have some more, make sure to send it our way, and I'll be more than happy to respond. In the meantime, stay home, stay healthy, take good care, guys.